Premature ejaculation occurs in men when semen leave the body sooner than wanted during sex. Premature ejaculation is a common sexual complaint. As many as 1 out of 3 people say they have it sometime. Premature ejaculation isn't a cause for concern if it doesn't happen often. But you might be diagnosed with premature ejaculation if you always or nearly always ejaculate within 1 to 3 minutes of penetration. If you are not able to delay ejaculation during sex all or nearly all the time, and if you feel distressed or frustrated and tend to avoid sexual intimacy as a result. Premature ejaculation is a treatable condition. Medications, counseling, and techniques that delay ejaculation can help improve your sex for you and your partner. Symptoms. The main symptom of premature ejaculation is not being able to delay ejaculation for more than 3 minutes after penetration, but it might occur in all sexual situations, even during masturbation. Premature ejaculation can be classified as 1. Lifelong. Lifelong premature ejaculation occurs all or nearly all the time, beginning with the first sexual encounter. 2. Acquired. Acquired premature ejaculation develops after having previous sexual experiences without problems with ejaculation. Many people feel they have symptoms of premature ejaculation, but the symptoms don't meet the criteria for a diagnosis. It's typical to experience early ejaculations at times. When to see a doctor. Talk with your healthcare provider if you ejaculate sooner than you wish during most sexual encounters. It's common to feel embarrassed about discussing sexual health concerns, but don't let that keep you from talking to your provider. Premature ejaculation is common and treatable. A conversation with your healthcare provider might help lessen concerns. For example, it might be reassuring to hear that it's typical for you to experience premature ejaculation from time to time. It may also help you know that the average time from the beginning of intercourse to ejaculation is about 5 minutes. The causes of premature ejaculation. The exact cause of premature ejaculation isn't known. It was once thought to be only psychological, but healthcare providers now know that premature ejaculation involves a complex interaction of psychological and biological factors. The psychological causes. Psychological factors that might play a role include early sexual experiences, sexual abuse, poor body image, depression, worrying about premature ejaculation, and guilty feelings that can cause you to rush through sex. Other factors that can play a role include 1. Erectile dysfunction. Being anxious about getting and keeping an erection might form a pattern of rushing to ejaculate. The pattern can be difficult to change. 2. Anxiety. It's common for premature ejaculation and anxiety to occur together. The anxiety may be about sexual performance or related to other issues. 3. Relationship problems. Relationship issues can contribute to premature ejaculation. This may be true if you had sexual relationship with other partners in which premature ejaculation didn't happen often. The biological causes. A number of biological factors might contribute to premature ejaculation. They may include irregular hormone levels, irregular levels of brain chemicals, swelling and infection of the prostate or urethra, and inherited traits. The risk factors. Various factors can increase the risk of premature ejaculation. They may include 1. Erectile dysfunction. You might be at risk of premature ejaculation if you have trouble keeping or getting an erection. Fear of losing an erection might cause you to hurry through sex. This might happen whether you are aware of it or not. 2. Stress. Emotional or mental strain in any area of your life can play a role in premature ejaculation. Stress can limit the ability to relax and focus during sex. The complications of premature ejaculation. Premature ejaculation can cause issues in your personal life. They might include 1. Stress and relationship problems. A common complication of premature ejaculation is relationship stress. 2. Fertility problems. Premature ejaculation can sometimes make it hard for a partner to get pregnant. This may happen if ejaculation doesn't occur in the vagina. Now, to the most important part of this video, the diagnosis and treatment of premature ejaculation. Your healthcare provider will ask about your sex life and your health history. Your healthcare provider might also do a physical exam. If you both have early ejaculation and trouble getting and keeping an erection, your provider might order blood tests. The test may check your hormone levels. In some cases, your healthcare provider might suggest you see an urologist or a mental health provider who specializes in sexual problems. The treatment. Common treatment options for premature ejaculation include behavioral techniques, medications, and counseling. It might take time to find the best treatment or combination of treatments that work for you. Behavioral treatment plus drug therapy might be the most effective. Behavioral techniques. In some cases, therapy for premature ejaculation involves simple steps. These may include masturbating for an hour or two before intercourse. This may allow you to delay ejaculation when you have sex with your partner. Your healthcare provider might recommend avoiding intercourse for a period of time. Focusing on other types of sexual play may remove the pressure you might feel during sexual intercourse. The pause squeeze technique. Your healthcare provider might instruct you and your partner to use the pause squeeze technique. This method works as follows. Begin sexual activity including stimulating the penis until you feel almost ready to ejaculate. Then you or your partner can squeeze the end of your penis where the head joins the shaft. Keep squeezing for several seconds until the urge to ejaculate passes. Repeat the squeeze process as needed. By repeating as many times as needed, you can reach the point of entering your partner without ejaculating. After some practice, delaying ejaculation might become a habit that no longer requires the pause squeeze technique. If the pause squeeze technique causes pain or discomfort, you can try the stop-start technique. It involves stopping sexual stimulation just before ejaculation, then waiting until the level of arousal has diminished and starting again. And lastly, condoms. Condoms might make the penis less sensitive, which can help delay ejaculation. Specially designed climax control condoms are available without a prescription. These condoms contain numbing agents such as benzocaine and lidocaine to delay ejaculation. They might also be made of thicker latex. Examples include Trojan Extended Pleasure and Duress Prolong. There you have it. Thank you for being with me to the end of this video. Drop your questions and concerns in the comment section and I'll respond to it accordingly. Kindly subscribe to my channel if you haven't and share my videos to your family and friends if you find it informative. Till we meet again, take a very good care of yourself. Remember, you can also make a difference and don't forget, Kofi loves you. Peace out.